My name's David. I've had a treatment from Dr Mathias, and I would like to express the reasons that I had to have the treatment more than anything. I had an accident in the 60s which was quite horrific, where my parents had to sign to say that my limbs, left leg, left arm, could be amputated if they couldn't be saved. And there was also some damage to my face, nose and teeth. From then on, as far as the teeth were concerned, it was slowly downhill for many years.
I've known David as a patient for the last 12 years, so that's quite a long time. I came across David when he came to see me initially with some broken teeth on his upper jaw. He had broken teeth, and he was given a denture by his regular dentist. He came in because his denture broke, and then we discussed options. We went through our treatment protocols, and David said, you know what, if you can give me something that's fixed, that would be amazing. He thought I was joking.
Well, all I can say now is that the difference is unbelievable. It's just, I wish that this treatment had been available a few years back so that I could have enjoyed life a lot more.
And in fact, we shared a common interest, Formula One cars, and both of us liked Formula One cars, and we used to discuss races and track events and everything that was going on. I was quite impressed by his knowledge actually on motorsport racing. This was David when he came to see me initially. So as part of my record taking process, what we tried and did was we took CT scans of his lower jaw. Now the CT scan tells me exactly where his important structures are, like nerves, blood vessels. I could remove the thing and I could see where I wanted the nerves to be, and I could get it back on there again. So we could superimpose and double check and make sure that it's safe for him to have implant treatment. What we also try to do is then we overlap images, we place our implants in, see the amount of bone that's present around the implant, how close the implants to the nerve. All this is done before we even start the procedure. So we know exactly the shape of the implant, the size of the implant, the number of teeth that are coming out, the length of the implant. So this is taking accuracy to the next level, and it's all about planning and making sure the patient's safe when having such complex treatment.
The reason I went with Dr Mathias now is the surgery that I was having said that I'd got to lose my teeth and have a plate, which got to me is not the right way to approach it, and because technology I know has moved on since the 60s, and this chap is the top of his game, and fortunately he's local enough for me to be here and see him.
And then we decided to go down the road of implants and fixed teeth at the end of the treatment. It's been 10 years now, and he's gleaming. I mean, it's given him a new lease of life, confidence when he goes out, and especially when he likes to chew his nuts. Yeah.
I now know what it's like to eat properly, which from the 60s I haven't really known how to enjoy and how to chew food, where teeth have now been put in where I didn't have teeth. So I don't know whether that's good enough, or whether that's, hopefully anybody who is slightly nervous about having the treatment, as far as I'm concerned anyway, there is nothing to worry about. You are working with a fully professional team of people, all of which I have the utmost respect for. The general outcome, as I've said before, is, as far as I'm concerned, excellent. No, nothing better. But my recommendation is get a set of these, because they're good. I mean it. I'm never going to wear these out if I live to be 100. I hope I do. The end justifies the means, because you can see what I've got, and there's no embarrassment for me to show you my teeth, whereas years ago it would have been, oh, hello, yeah, my name's Dave, and that would have been the best you got. I can honestly say, and I kind of keep repeating myself, it's excellent. Get it done. Don't argue. Don't think about it. Get in there and get it done. I envisage a lot of people in the future having this done for probably very selfish reasons, where they just want to look pretty. I'm never going to look pretty, but I can eat now and I couldn't before. So get it done, please, if you really want to.